Hello, my name is Cheryl Wagner, and I'm going to be presenting the research portion of our project. The Affordable Care Act has been in effect for over 6 years. Despite its accomplishments, it's still being challenged by the Republican Party, and multiple appeals have been made to the Supreme Court since its inception. A recent appeal took place in January 2016. In January 2016, ABC News reported the Supreme Court ruling of 6-3 in favor of continuing to provide federal subsidies to people in need of health insurance, despite some states' refusal to set up health insurance exchanges. They reported that these federal subsidies already helped 6.4 million Americans in 34 states purchase health insurance. Chief Justice of the Supreme Court, John Roberts, states that their accusation made no sense given the purpose of the law. Congress passed the Affordable Care Act to improve healthcare insurance markets, not to destroy them. President Obama, addressing the ruling shortly thereafter, said, "This is healthcare in America. What we are not going to do is unravel what has now been woven into the fabric of America." So what exactly has Obamacare done for the people over the past 6 years? In July 2016, ABC News reports President Obama authoring an article in the Journal of American Medical Association highlighting the success of the Affordable Care Act. Using government data, he reported that the rate of uninsured Americans had dropped from 16% in 2010 to 9.1% in 2015. That's 49 million uninsured down to 29 million. The president also reported that Medicare spending had slowed since Obamacare took effect. The president listed future challenges that included the further expansions of Medicaid, controlling the increase in drug prices, and the need for greater competition in certain healthcare markets. The president did not address the 20 to 25 million Americans that remain uninsured or the increase in healthcare costs in the private sector. So let's explore the possible increase in healthcare premiums that are currently being discussed in the media. A growing concern for Americans is the rumored increase in healthcare premiums for next year. The Huffington Post reports that over half the people interviewed by Henry J. Kaiser Foundation believe that all insurance rates will increase. The truth is, the only proposed increases apply to those who are using individual insurance exchanges and not those who are insured through their employer. Most Americans are insured by either their employer's insurance plans or government programs such as Medicare and Medicaid. 155 million US residents, which is 48% of the population, utilize healthcare insurance offered by their employer. Only about 21 million, or 7% of the population, utilize individual insurance exchanges. Of the 7% that utilize individual insurance exchanges, 83% of those received tax credits last year to reduce their costs. These subsidies were designed to cap premiums at a percentage of an individual's income to reduce cost, thus protecting the individual enrollees who are economically disadvantaged from price increases. This helps individuals who are not previously insured gain access to healthcare services without significant financial burden. A study by Nyman and Trends used data from the 1996 to 2008 Medical Expenditure Panel Survey to illustrate the affordability of healthcare services in the pre-Affordable Care Act period. Information from a sample of U.S. households showed that 36.5% of all insured healthcare spending would otherwise be unaffordable. They divided it up into private versus public insurance, saying that privately insured would be able to cover all but about 20.5% of their spending. So it would still cost people money in the private sector. And in the public domain, 86% of healthcare spending would be unaffordable without insurance. Before the Affordable Care Act, many Americans were not able to afford to have their basic health needs met. A study reviewing the aftermath of the expansion of Medicaid in Oregon foreshadows future effects of healthcare expansion in all areas of the U.S. This study focuses on public utilization of community health services and the longer-term impact preventative care can have on the healthcare system. Not only did it show that an increased utilization of community healthcare services, but it also showed a reduction in the use of emergency medical and hospital services. This can help reduce the financial strain on hospitals, which often incur the costs of emergency room visits and hospital stays from those who have medical conditions that have been untreated for years. A telephone survey was conducted in 2013, which included over 2,000 low-income U.S. citizens in 3 southern states, ages 19 to 64 years old. It compared access and quality of care for people with Medicaid, private insurance, Medicare, and the uninsured. It showed that low-income adults with insurance report significantly greater access and quality of care than uninsured adults, regardless of whether they have private or public insurance. This confirms the goal of the Affordable Care Act, which aims to provide healthcare services to all Americans. Thank you.